Welcome back to TV5 News at 9. Today we are talking with Michigan Health Clinic's Chief Medical Officer, Dr. David Stockman. Thank you so much for joining us today, Doctor. We appreciate it.
Good morning.
Good morning. Okay, today we're talking about COVID-19 testing. So first tell us, how long does it take for someone to get their testing results?
So at Michigan Health Clinics, we're turning over results within the next day. So you should see a result within 24 hours. In a few days, we'll be rolling out a new platform for testing that'll actually give us results or give the patient results on the same day.
Oh my gosh, that is awesome. You don't usually hear about that. Okay, so do people need to make an appointment, doctor?
They do not. They can actually walk in, they get screened by a provider, and they'll get tested.
Now, you know this, of course, and being a doctor, people are apprehensive of testing. So tell us, what actually goes into this test? What can they expect when they come in to get a test?
Sure. A lot of people get concerned about, having the swab pushed all the way down into their nose. That is the most sensitive method of collection, but we can actually just do a swab which rotates around the anterior portion of the nose, or you can actually just do a swab of the mouth as well, which makes it a little more comfortable, especially for young kids.
Oh, doctor, I don't think everyone knows that. I think that you made someone's day there. That's perfect. Thank you for telling us about that.
Right.
Yeah, so if someone tests positive, doctor, what should they do? And what should they do about telling their family and loved ones?
Sure. So, when you test positive for COVID-19, it's important that you quarantine according to the CDC guidelines, which right now is telling everybody to quarantine for at least 10 days. If you're mildly symptomatic, there's probably still potential for you being infective or infectious. But at that point, quarantining for 10 days should prevent any sort of infection from continuing. Also, making sure that you tell your close contacts, whether or not those are family members or people that you live with, they're most likely going to end up being positive. So whether or not they necessarily need to get tested, it's kind of on a case-by-case basis.
And would you?
But you can most likely assume that everybody's going to be positive in the family.
Okay, all your close contacts. Now, would you recommend that everyone get tested, that they just go in and get a COVID-19 test?
So no, not at all. So it's definitely important that you consult with your physician if you're starting to experience symptoms. Obviously, in the current day and age, if you are experiencing symptoms, it's most likely that you do or you may in fact have coronavirus. So it's only if you're experiencing symptoms that you should really come to get tested. Some people with exposure history, if you have been exposed, you should probably wait at least between 3 to 5, even 7 days before you actually go and get tested.
Okay, so that's the advice that you would have for someone who's been exposed, to wait?
Correct.
A few days. Okay.
The virus won't present and show itself, and you'd probably end up with a false negative if you tested too early. So, for example, if I was with my friend who tested positive yesterday, I should wait at least 3 to 5 days after I was with them before I went and got tested.
That's perfect. Well, thank you so much, doctor, for giving us this valuable information. I think you put a lot of people's minds at ease this morning. Thank you very much for stopping in.
Great. Thank you.
You're welcome. And thank you again for watching. If you have any more information about this topic, just head on over to the hot link section of WNEM.com.